Today's Learn with Lo is going to be dedicated to all of my fellow providers out there. So hello and happy Monday to everyone that is joining us live, or if you're watching the recording, welcome. I'm super excited to continue our conversations here, especially as we speak a little bit more closely to some of my fellow functional practitioners or healthcare providers out there, because what I have seen time and time again is in this space, especially when we consider our topic that we've been discussing around hormone care and all of our different strategies for age-related hormonal decline, whether you are a male or a female, we've really gotten an opportunity to dive in a little bit deeper at options, right? And we've been really thinking a lot about the reframe of terms like perimenopause, not as this like fearful hormonal failure of my, ovaries just like going offline. But really what we're seeing here with a lot of our age-related decline is this massive reveal. We're seeing a reveal of the things behind the scenes that have been trying to hide, but behind this veil of estrogen and progesterone and testosterone, once that veil starts to drop, all of a sudden we are faced with a lot of the things that we were probably trying to hide behind for quite some time, or some of those more inflammatory processes that were going unnoticed and untreated for us. So if you are a fellow practitioner in more of the healthcare space, then this conversation will really resonate with you. If you are more of a patient in the healthcare space, you might also love this conversation because it will justify for you or validate for you why maybe you've been struggling to find a provider that you feel very connected with and a provider that you feel like truly gets it. Because I'm not going to lie, even in this field of what I would call like functional medicine, which, let's be real, half the time I don't even know what to call myself because I don't feel like I fit into the normal parameter of functional medicine these days. But when we think about someone who's thinking outside of the conventional medicine kind of pill for every ill box when it comes to hormone care, we really start to see a lot of the same themes come into play even in the functional care space. And that's super frustrating for me because I think we as practitioners have a higher calling to understand the body differently and not just be another talking head that is practicing cookie cutter template medicine and expecting that functional medicine and actually hormone care is just giving somebody more hormones. And I just cannot get behind that. And I think that even patients out there deserve a provider and a practitioner that really gets it. And when I say gets it, they understand how to zoom out. They understand how to look at anatomy and physiology as a whole. And they're not going to just pull the hormones, like your sex hormones, out of the system, tinker with them and try to put them back into the same exact body. It's like, it's not going to work. And it's never worked. And we probably need a little bit better game plan and a little bit better strategy. And I think, like I said, this has been a conversation that has been on my heart and on my mind for quite some time because working in this field, have a lot of peers and mentors in the space that I mastermind with, but then also training and mentoring the next evolution of functional medicine providers. Something in my holistic medicine mentorship program that I am all about is making sure that we are truly understanding what we're signing up for if we are going to take on this commitment to practice root cause medicine. Okay. If we're going to sign up for that, we are now signing up to be at a higher level. We're signing up to be at a higher caliber. And we are also committing to providing a better healthcare experience than the conventional healthcare model. Now, if you're just going to do the same conventional healthcare things, but call yourself functional medicine, get out. Right? Like, get out of here because you're just confusing patients and you're setting yourself up for high expectations and not being able to meet those expectations because people are going to be probably disappointed in that level of care because they've already had that level of care and it has failed them time and time again. So I think, like I said, I've been thinking about this conversation for quite some time, and it really hit the nail in the coffin when I had an amazing exchange with a potential new patient over social media not too long ago, where she had inquired about looking for a different functional medicine provider is what she was looking for. She got referred my name, and she was reaching out, inquiring some questions, and she had stated, she said, yeah, I've been having some issues for quite some time, lots of things that someone might dub like hormone symptoms, right? She was having some night sweats, she was having a lot of bloating, she was having a lot of menstrual cycle concerns and menstrual cycle changes, she was even noticing some skin issues, some body composition changes, all of these things, right? And so she sought out what she thought and what she was told was a functional medicine provider. And what she got was a complete lab workup, which is awesome. But when I say complete lab workup, all they ran was her hormones. And based off of that hormone lab, she's like, yeah, my previous functional medicine practitioner first put me on testosterone pellet. And then when I continued to have issues with the same symptoms, they just upped my testosterone dosing and then started me on estradiol. I'm like, okay. And then when I was still having symptoms, they wanted to put me on spirolactone for the acne caused by the testosterone. Oh, and also they prescribed me Ozempic because I wasn't losing weight. And I'm like, hold the phone here. This was your experience with what you got sold was functional medicine. That was not functional medicine. That was a complete conventional medicine experience because all you were served is more pills. Like someone was just treating your lab and being like, oh, your testosterone's low. Here's testosterone. Oh, that's not working. Here's more testosterone. Oh, that's not working. Here's some estrogen. It's like, hormone care, and if you're signing up to help individuals really manage and understand these age-related hormonal decline transitions like perimenopause or even what males experience as andropause, you're working with a very vulnerable population and a population that is looking for expert advice and help. And if you're just going to meet them with more hormones, that this is probably not the space for you. And if you are a patient listening to this, trust and know that if that has been your experience with what you thought was functional medicine, you got duped. Okay, that's not functional medicine, is not more hormones. Okay, so if you got handed more hormones and then you got handed like more prescriptions for the side effects of those hormones, like that's not answers and that is not care. Okay, we kind of get duped into thinking like, I got great care. You did not get great care. You got more Band-Aid solutions and all of these like new prescriptions and more dosing. It's just really no more than like hormone-based Band-Aids with a higher price tag, in my opinion, okay? No one asked her about her adrenals. No one has looked at her gut health. No one has looked at her liver detox pathways before starting her on hormone replacement therapy. No one is looking at her cortisol patterns, her nutrient depletions, or her stress physiology. And this is exactly why so many individuals, not just females, but I would say that females are kind of one of those most vulnerable populations, are just straight up getting duped. And I think that's what's giving for some individuals this like functional medicine, alternative medicine, root cause medicine, and a bad name. Because we have practitioners out there that quite frankly, they are falling short of their commitments. They think that like, oh, hormones are just declining and hormones are just disappearing with age. So I know I'll just give them more. That's not how this age-related transition works. Go back to my previous episode from last week. We talked about how age-related hormone decline is really just a shift. We're shifting from the ovaries and from the testes to the adrenals. But if the adrenals are already entering this age-related hormonal decline, already exhausted, even the best like HRT protocol is going to backfire. It's not going to have a great soil to land on. So here's really kind of the truth that I want to dive into a little bit today is kind of the current functional medicine landscape to me that's jumping straight to hormones really is practicing lazy medicine. This is, you're not doing any of the work or asking the underlying questions of what is the ultimate terrain in which is allowing these hormones to operate the way that they are in the first place. So to me, there's kind of a lot of hormone hype out there. And I absolutely adore, and I love that these age-related conversations are getting some attention, especially for perimenopause females that have really been gaslit for a very long time of thinking like, oh, it's just stress, like here's some antidepressants, or we're told we're just crazy, right? It's like, no, there are some very real hormone shifts. I use that word very strategically. Hormone shifts happening in a perimenopause state, or even as men age, there's also going to be a hormone shift. But we have to get away from this like fear and franticness that we're building for perimenopausal females, because guess what? Then if we put these perimenopausal females under this like fear and frantic energy, they're going to make very desperate choices. And they're going to seek out, like I said, some of these like practitioners and providers that are just doing more of these like hormone band-aid medicine. And then they get duped into thinking like, wow, I got great care because I went in and they ran labs and they gave me a testosterone pellet, and then they gave me more, and then they gave me estrogen, and then they gave me spirulactone, and then they prescribed me weight loss medications. I'm like, you did not get care. You got Band-Aids. And unfortunately, like I said, that's what gives functional medicine a bad reputation, because it's starting to look a hell of a lot like conventional medicine, but just with fancier marketing strategies. So when women are coming in feeling exhausted and inflamed and irregular cycles and just completely disconnected with their body, and you as a functional medicine provider who is signing up to committing to a higher degree of care, and all your training has been up until this point is like, oh, here's some bioidentical progesterone cream, here's an estrogen patch, here's some hormone pellets, or worse, you start filling her with supplements and it's like, here's some DIM, here's some Vitex, and not a single word about her foundations, not a single word, a single test talking about the liver, the gut, or what about the adrenals that are going to be taking over a bulk of her hormone production in perimenopause, right? Like that's like just trying to build a house on a very, very cracked foundation. And the clinical reality is we're seeing this a lot, where practitioners are not well trained or are just straight up overlooking an inflamed, a sluggish and dysregulated terrain and decide to add more hormones into that chaos. And to me, that's why we're seeing so many patients either jump from provider to provider, really looking for someone that gets it, or they're leaving feeling very disappointed, very gaslit, very dismissed, or they just feel like they're the ones that are broken because they actually went outside of conventional medicine to try to find some alternative mindsets and alternative solutions, and all they found is more of the same things, just with fancier marketing. So to, like I said, all of my practitioners out there who are building practices, but have a thought process around serving patients in a different way than more of the conventional medicine, that's where a lot of practitioners leave the conventional medicine, because they're like, this ain't it. They're like, I don't know what is it, but this ain't it. I'm not able to spend as much time with my patient. I'm not able to truly provide them the deep diagnostic level of care that they deserve. I just spend 5 to 7 minutes with them and I have to send them on their way with a prescription. Well, if you're going to do the same thing from a functional medicine perspective, but you're just going to run more expensive labs and have them pay out of pocket for some pellet treatment, it's like something's hugely missing here. And I don't want any more patients to get duped by thinking that that is root cause functional medicine, because it's not. That's really just like a clinical strategy and like a clinical business model versus really looking at what's in the best interest of the patient. So when I think about the low down methods and how I really operate and teach my mentors in terms, or my mentees, I should say, how I teach my mentees that are in my holistic medicine mentorship program, which is a 12-month mentorship program, where we really understand that the order of operations is the secret sauce here. So if you truly are signing up to help individuals with more of that root cause medicine mindset, you have to be really rock solid in your physiology. You have to understand how the body works from a zoomed out perspective. I'm not talking about like zooming in and being able to like understand the dosing of HRT. I'm talking about being able to zoom out and look at the entire terrain and really question, like, is the system even ready for HRT in the first place? Where are the clogs? Where are the bottlenecks? Because if they're not managing the current level of hormones that they have right now, why would I just put more in? You're going to put more hormones into chaos and more hormones into like a clogged system. So I just feel like our patients deserve a lot more education and a lot more respect than that. But we have to really have the clinical confidence to then be able to zoom out. So thinking about order of operations, right? When I think about the lowdown methods and how I really teach my holistic medicine mentees to understand hormone care is in a very strategic order of operations. Number one, we have got to think about adrenals, okay? I talked about this in my episode last week where we see this shift. For women, it's a shift away from the ovaries and into the adrenals. For males, it's a shift away from the testes and towards more of the adrenals. We don't see it quite as much in males or as drastically as we do in males as we do in females. But we have to think about, like, are the adrenals ready to pick up this responsibility in peri and postmenopause? Because if the answer is no, then we're going to shove more hormones into a system that is not ready for it. So that peri and postmenopausal transition, the adrenal glands are going to take over as primary producers of the sex hormones. But most individuals are going to hit this age of this hormone related decline already with decades of cortisol dysregulation, trauma stamped nervous systems, underfueling, over-exercising, caffeine binging, and you can't just hand someone more estrogen while their adrenals are still stuck in survival mode. Okay, we have to make sure that as practitioners, do we understand the physiology behind what changes we're trying to drive here? So we have to really look at whether that is through some strategic testing and also through the big rock work of evaluating someone's lifestyle and nutritional patterns and self-belief systems. Like, are their adrenals ready to really pick up this load of sex hormone production going into this next chapter of their life? So that's always got to be step one. And like I said, I have plenty of education on like the details of exactly what that looks like inside my holistic medicine mentorship program. So I'm just going to go through like a high level overview. That way you as a practitioner in this space can kind of check yourself to see whether your brain is kind of thinking about the same order of operations. Or even if you're a patient out there, you can also kind of audit honestly the care that you've been receiving and kind of evaluate like, okay, are we going through those strategic order of operations as well? So number one has got to be the adrenals because they're going to pass and take on a big bulk of this. Number two has got to be gut health. Okay. Gut health is such an overlooked thing. I just literally had a conversation with a gal who left my office the hour before this, where she was having all of these perimenopause related cycle symptom issues, and it's coming from her gut. Right. And she's like, well, I don't really have a whole lot of gut symptoms. I was like, no, I understand that. But if we try to add more hormones in, things aren't going to go well. I'm like, let's take, for example, she had used a DHEA supplement in the past. Now, DHEA, if you know anything about it, is created in the adrenals, and it is a precursor to sex hormones. So she had, with a previous provider, she had taken or been prescribed DHEA supplementation, and she broke out with acne and her skin went wild. I was like, so if that's what happened when we put a hormone precursor into the system, do you think your body's ready for like more hormones? And she's like, oh yeah, hell no. I'm like, no, the body's not ready for more hormones just yet, because we have to figure out where is this inflammation coming from. We put like a little DHEA precursor in and poof, things go wild, right? So the gut is going to influence your hormone in really three major ways. Number one is absorbing key nutrients, like all of the key cofactors that are required to even make sex hormones in the first place. B vitamins, minerals like zinc and magnesium. We absolutely need these, not to mention things like vitamin D as well too. Number 2 is going to regulate estrogen metabolism via the estrobolome. The estrobolome are certain species of bacteria found in the gut that regulate overall estrogen recycling pathways. And then number 3 is we also see the gut preventing a lot of the intestinal permeability or leaky gut that leads to more autoimmune activation that also wears on hormones as well. So if your gut is inflamed, rest assured that your client or your patient is really not even going to tolerate even the most natural hormone protocols. Like I gave this example with like literally 5 milligrams of DHEA is where she had this response. So it's like bloating, mood swings, histamine flare-ups, all of those, they're not necessarily side effects of the hormone replacement. They're symptoms of a body that wasn't ready for the hormones in the first place, okay? So I'm not anti-hormones. I'm just talking like order of operations. She probably wasn't ready for them yet. And then that leads me to number 3. So step 1, adrenals. Step 2, gut. Step 3 is the liver. Whatever's happening in the gut is going to put stress on the liver. So if you think about the liver and its main job is to detox any of these hormone metabolites, right? So if you ever want to support the hormone pathway, you have to clear out any traffic jams. So this is where we really look at not just like how much hormones do you have in the system. I don't always just care about how much estrogen a female has. I care about where the heck is it going? Is it getting adequately through phase 1 metabolism? Is it getting through phase 2 metabolism? Is it getting excreted all the way out of the body through phase 3 metabolism? Or are we hitting some bottlenecks? Are we creating some really inflammatory intermediates of estrogen that's increasing her risk for hormone dominant cancers or increasing her risk for fibroids or endometriosis, right? It's like, I want to know where the estrogen's going, not just how much estrogen do you have. And this is where actually being able to evaluate phase 1 and phase 2 estrogen detox is key. Or here, by looking at the liver, we also get to factor in any genetic predispositions. Are there some genetic polymorphisms or some genetic SNPs that are preventing someone from actively methylating properly? Like that is huge in terms of not building up and actually being able to recycle our estrogen and not create any clogs or create any traffic jams in that situation. So you have to clear the blocks before we just add more hormones. Now, if the adrenals are ready, the gut is nice and resurrected and restored, the liver pathways are all unclogged and everything is flowing freely, then hormones, right? Then hormones like would make sense. And now, only now at that very end stage, to me as a functional provider, like hormones come last, okay? Then we can consider hormone support because at that point, in my personal experience, now my patients find that they need a lot less hormones than they thought they did. Minimum effective dosing. They're like, oh, my provider was dosing my estrogen and testosterone and progesterone like through the roof to try to compensate for all of what was really an adrenal issue, a gut issue, or a liver issue all along. So once we kind of cleared out the noise, restored the pathways, recalibrated the system, maybe we don't even need any hormones. Or if we do still need a little bit of a hormones, it can be a sprinkle and we can put a sprinkle on the top and they are feeling fantastic versus trying to come in a mega dose to try to overcompensate for an incredible amount of inflammation that actually was blamed on the hormones but wasn't a hormone issue, okay? So just speaking to my fellow providers out there, I wanted to give an opportunity for you to get a real life taste test a little bit of what is available and what I really press and educate on in my holistic medicine mentorship program. So if you're not familiar with it, it is a 12-month holistic medicine mentorship program where you get not only the clinical application of just like these things that I'm talking about today, but also business strategy to be able to relate to patients and not just like learn the clinical medicine in a cookie cutter templated way, but truly understand how to work with the whole human experience, the psychology, the mind body medicine, as well as the physical medicine. So I want more functional providers out there that are thinking like practitioners, not these protocol robots. I want more practitioners out there that are understanding biology and the right order of operations, not just like some lab interpretation and they're just going to treat a number on a lab. I want to help providers really bridge biology with energy and layer in clinical medicine with also mind-body medicine as well too, to build this root cause oriented, soul aligned, thriving practice where they feel like they're getting great success with their patients, getting a massive referral business, and also living in a way that feels great for their nervous system as well too. And so all of this like hormonal cascade and some of these conversations that we talked about today are all part of the Q4 of curriculum in that holistic medicine mentorship. So you have 4 quarters worth of content in our 12-month mentorship to really start to build a lot of these clinical skill sets. So if you are a functional provider, or you are curious about adding to your skill set, or maybe you are a healthcare adjunct provider and you're curious about really getting into this type of work and adding it to your clinical toolbox, check out my website, click on the mentorship tab, and learn a little bit more about my holistic medicine mentorship program. And there is a spot where you can reach out and apply as well too. So hopefully this was helpful for all my providers out there. And like I said, for my patients, making sure that you also feel like you're getting the care that you deserve as well. Have a wonderful week, and we'll talk to you guys next week.